The trauma bay doors slammed open at 2:47 in the morning, and Nora Vance didn't need anyone to tell her this one was bad. She could smell it before she saw it, copper and scorched fabric, the particular stench of a body that had been broken by something other than a car crash or a fall down the stairs. Two paramedics wheeled in a man in torn military fatigues, his chest rising in short, ragged pulls, blood soaking through a hastily wrapped field dressing that someone without proper training had clearly applied in a panic. Multiple GSW, unresponsive twice in transit, BPs dropping. One of the medics shouted, and the rest of the trauma team surged forward the way they always did. A practiced chaos that looked like disorder to outsiders but was really the tightest choreography in the hospital. Nora moved with them, but something in her hands had already changed. Her fingers weren't shaking the way they had when she first started this job 3 years ago. They were still, steady, almost eerily calm, the way a surgeon's are supposed to be, not a floor nurse's. Dr. Alan Whitfield, the attending on shift, was barking orders that sounded right but weren't quite right, calling for a chest tube kit before he'd even confirmed the pneumothorax, wasting precious seconds double-checking equipment that any combat medic could read in a glance. Nora didn't wait for permission. She grabbed the patient's wrist, felt for a pulse that was there but thready, then pressed her palm flat against his ribs in a spot that made Whitfield blink. "Tension pneumo, left side, he needs decompression now, not in 2 minutes," she said, and her voice didn't waver, didn't ask, didn't hedge the way nurses were trained to hedge around doctors. Whitfield's head snapped toward her. "I didn't ask for your diagnosis, Vance, get me the—" But Nora was already moving, already pulling a 14-gauge needle from the crash cart, already positioning it at the second intercostal space with a precision that looked less like nursing and more like something out of a battlefield manual. "If you wait for imaging, he dies before the film develops," she said quietly. And there was something underneath her calm that silenced the room for exactly 1 second. Then Whitfield, furious but out of time, snapped, "Do it, then, if you're so confident," and stepped back just enough. The needle went in clean. There was a hiss of escaping air, immediate and unmistakable, and the monitor that had been screaming its warning tones began to settle, the numbers climbing back from the edge of a cliff. The room exhaled collectively, that strange half-second of relief hospital staff allow themselves before moving to the next crisis. But Nora wasn't finished. She was already checking the exit wound on his thigh, already calling for 2 units of O-negative before the tech had even typed his blood, already noting aloud that his breathing pattern suggested a possible flail chest that the trauma scan would confirm in 20 minutes but that she could already see in the asymmetric rise of his ribs. "How do you know this?" Whitfield muttered, not really asking, more thinking aloud, watching this nurse move through a resuscitation like she'd done it 100 times in conditions far worse than a fully staffed trauma bay with lights and suction and a crash cart stocked to capacity. What none of them knew, what nobody at St. Aldrich Medical Center had ever known in the 3 years Nora had worked there, was that she had done this before in conditions immeasurably worse. Not under fluorescent lights with a full team and backup on call, but in the dark, in the dirt, under fire, with nothing but a med bag and her own 2 hands standing between a wounded man and the end of his life. Before she was Nora Vance, RN, she had been Petty Officer Nora Vance, a combat corpsman attached to a naval special warfare unit, the kind of assignment that didn't exist on paper, the kind of work that came with a signature on a document promising she would never speak of it. She had held pressure on wounds while bullets cracked overhead. She had made decisions in 90 seconds that surgeons here took 20 minutes to reach with a full diagnostic suite. And she had buried that version of herself so completely that even her closest co-workers thought her calm under pressure was just a personality trait, an admirable quirk, nothing more. The man on the table stirred, his eyes fluttering half open beneath the oxygen mask, and for one disorienting moment his gaze found hers and something passed between them that nobody else in the room understood. His lips moved, cracked and dry, and though no sound came out, Nora read them anyway. Document. Not the polite deference of a patient to a nurse, but the specific weighted word a wounded operator uses for the medic who patched him up in the field. Nora's jaw tightened almost imperceptibly. She leaned down, adjusted his mask, and murmured just low enough that only he could hear, "You're safe now. I've got you." It was the exact phrase, word for word, that combat corpsmen were trained to say to keep a wounded man's mind from slipping into shock, and somewhere in his fractured consciousness, the seal on the table recognized it too. Whitfield straightened up as the resuscitation stabilized, wiping sweat from his brow, and looked at Nora with an expression caught between grudging respect and open suspicion. "That was textbook trauma triage," he said slowly. "The kind we don't teach nurses." "Where exactly did you learn that?" Nora didn't answer right away. She busied herself charting vitals, avoiding his eyes, the old training kicking in automatically. Deflect, minimize, disappear into the routine. But behind her, unnoticed by everyone in the chaos of the trauma bay, a man in a dark suit had been standing in the observation hallway for the last 4 minutes, watching everything through the glass with the stillness of someone who had seen 1,000 crime scenes and recognized when something didn't add up. He held an FBI badge clipped to his belt, and he had come to this hospital tonight for an entirely different reason. But now his eyes were fixed entirely on the nurse in blue scrubs, and he was already reaching for his phone to make a call that would upend everything Nora Vance had spent 3 years trying to forget. Chapter 2. Special Agent Marcus Reyes had not come to St. Aldrich Medical Center to watch a trauma resuscitation. He'd come because the wounded man on that table, identified only as John Doe military by the ambulance crew, was connected to a federal investigation that had occupied his division for the past 8 months. An inquiry into a black market weapons pipeline with tendrils reaching into a special operations logistics chain. The moment word came that a naval operator had been shot during an off-book extraction gone wrong, Reyes had been dispatched to observe, to ask quiet questions, to see who showed interest. He had expected nervous doctors and standard procedure. He had not expected to watch a floor nurse perform a needle decompression with the fluid, unhesitating certainty of someone who had done it under fire, nor had he expected to hear her murmur a phrase, "You're safe now, I've got you." That Reyes recognized immediately, because he'd heard Naval Combat Corpsmen use those exact words in an entirely different context 2 years earlier, during a briefing about extraction protocols he'd sat through as part of an interagency task force. He waited until the trauma team had stabilized the patient and wheeled him toward imaging. Then he stepped into the bay before Nora could retreat to the nurse's station, flashing his credentials with the practiced ease of a man who'd done this 10,000 times. "Agent Marcus Reyes, FBI," he said, his voice even but his eyes sharp, cataloging her reaction the way he cataloged every reaction in every interview he'd ever conducted. "That was an impressive 4 minutes in there, Ms. Vance. I've seen trauma surgeons freeze on less. I need to ask you something, and I'd like an honest answer. How does a nurse know how to perform battlefield triage?" Nora felt the floor tilt beneath her, the careful architecture of her civilian life creaking under a question she had trained for years to never have to answer. "I read a lot," she said, the deflection automatic, threadbare even to her own ears. Reyes tilted his head slightly, unimpressed. "You didn't read that. You lived it. I need you to understand something, Ms. Vance. The man you just saved is connected to a federal investigation, and if you have information about his service history, his unit, anything at all, withholding it isn't just unhelpful. Could be obstruction." Whitfield, still lingering nearby under the pretense of charting, watched this exchange with poorly disguised fascination, and it was his voice, not Reyes's, that finally cracked the dam. "Tell him, Nora," he said quietly, more gently than she'd ever heard him speak. "Whatever it is, I saw what you did in there. That wasn't luck." Nora closed her eyes for one long moment, feeling 3 years of careful invisibility collapsing at once, and when she opened them, something in her posture had changed, straightened, the civilian slouch replaced by something older and steadier. "I was a Navy corpsman," she said quietly, "attached to a special warfare unit for 4 years. I can't discuss operational specifics, most of it's classified, and I sign documents that mean exactly what they say. But I recognized the entry wound pattern on that patient. It wasn't from a standard firefight. It was from a weapon I've only seen once before, in a country I'm not allowed to name, in an operation that officially never happened." Reyes went very still, and for the first time that night, his composed federal agent expression flickered into something closer to alarm, because what Nora had just described lined up exactly with a weapon signature. His task force had been chasing for 8 frustrating months, a signature that was supposed to be impossible outside a specific, tightly controlled supply chain. "I need you to come with me," Reyes said, and this time there was no ambiguity in his tone, no room for deflection. "Not under arrest. As a witness, possibly as an asset." What you just told me might be the piece we've been missing. Nora glanced toward the imaging suite where the seal, her seal, in the old language she'd buried but never quite forgotten, was being wheeled through for a CT scan, still alive because of decisions she'd made in 4 impossible minutes. I need to see that he's stable first, she said, and it wasn't a request. Reyes, to his credit, nodded, some old instinct in him respecting the chain of priorities even in the middle of an investigation. 20 minutes later, with the patient stabilized and resting under careful monitoring, Nora sat across from Reyes in a small consultation room, and the story that unspooled from her over the next hour would eventually blow open a supply chain investigation that had stalled for the better part of a year, connecting a decorated but disgraced logistics officer to weapons that should never have left a secured facility. Word moved through the hospital fast, the way it always does, and by morning half the staff at St. Aldrich knew that quiet, unassuming Nora Vance, the nurse everyone liked but nobody really knew, had once been something else entirely, something most of them would never have guessed in 1,000 years. Whitfield found her at the end of her shift, exhaustion carved into both their faces, and for once his voice held no trace of the arrogance that had defined every interaction between them for the past 3 years. I owe you an apology, he said simply. I've spent 3 years assuming I knew more than you in that trauma bay. Tonight proved I had no idea who I was working with. Nora managed a tired smile, the first real one in hours. You didn't know because I didn't want you to, she said. But I'm not sorry it came out. He's alive because of what I used to be, and that man in there, Reyes said he asked for me by name before he went under for surgery. Some things don't stay buried forever, I guess. 3 days later, in a quiet hospital corridor far from cameras or fanfare, a small contingent of naval officers arrived to formally and quietly acknowledge what Nora Vance had done. Not just that night in the trauma bay, but in a career of service that had shaped her far more than anyone at St. Aldrich had ever imagined.